Hi, welcome everyone. My name is Victor Mercadante. I'm an assistant professor here at Virginia Tech, and I'm currently the chair of the Beef Reproduction Task Force. And I want to welcome everyone to the last webinar of our spring series. We plan to continue doing this every year, and it's always nice to see a lot of people signing in, people from all over the country and other places as well, from all over the world, quite frankly. And it's been quite rewarding to put this series together. So we want to appreciate and say thank you to you guys to tuning in every third Tuesday of the month with us, so we can talk about beef cattle reproduction. Hopefully you're seeing there in your screen. We have finally been able to secure a location and dates for the Apply Reproductive Strategies in Beef Cattle. So we're going to be doing that in San Antonio, Texas on August 30 and 31. Going to be an in-person meeting. So we're looking forward for that. And it's been 2 years since we've been able to do this. So we're very excited about that, that ability to be able to meet in person and see you guys a little bit different than in Zoom. So I'm going to be sharing more information in the coming weeks with a link for registration and a hotel and everything else. So just stay tuned to our website and our Facebook and Twitter accounts, and we're going to be sharing more information again in the coming weeks. Okay, so today's webinar is sponsored by Elanco and the ViraShield vaccine. So we want to thank them, and we also want to play a little promotion video that they offer to us. And while we're doing this, we did this last month and I really like this. So I want to, you guys, if you don't mind, type on the chat box where you're from, and if you're doing AI and ET on your cattle, and for how long you've been doing that. If you don't mind sharing that information with us while we watch the video, I really appreciate it. Okay, so we're going to play this video and I'm going to be right back.
If beef or dairy cattle are part of your veterinary practice, you know that safeguarding the health, wellness, and productivity of your client's herd is critical to your success. When it comes to disease prevention, veterinarians the world over know that vaccination is the key. The ViraShield family of vaccines is a powerful weapon against the viruses and bacteria that threaten the health of your client's herd. Each of the different ViraShield combinations contain the Extend SP adjuvant, a key component in the outstanding efficacy of this product range. In accordance with beef and dairy quality assurance guidelines, you should take care to inject in the neck region, ahead of the shoulder, according to label directions. ViraShield products include combinations with up to 13 antigens, giving you the flexibility that ensures the vaccine program you set with your client is exactly what their herd needs. Here, we see that one injection of ViraShield 6 contains antigens for 4 major bovine viral diseases, including type 1 cytopathic, type 1 non-cytopathic, and type 2 non-cytopathic bovine viral diarrhea virus, infectious bovine rhinotracheitis, bovine respiratory syncytial virus, and parainfluenza 3. These 6 antigens are included in all ViraShield 6 combinations. Once introduced into the body, these 6 antigens meet and interact with immune cells in the surrounding tissues. One particular group of cells, the dendritic cells, play a vital role in building immunity. These specialized cells present the ViraShield antigens to the cells of the immune system and trigger an acquired immune response. The interaction of the antigen with dendritic cells and also B cells begins the process of acquired immunity. Once inside the cell, the antigens are broken down to their protein backbones, also called epitopes. T helper 2 cells will be activated by the MHC2 expression to produce a humoral response. In a humoral response, the activated T helper 2 cells will come into contact with B cells which maturate to plasma cells. These specialized cells are the workhorses of the immune system. They produce neutralizing agents called antibodies against harmful foreign invaders like viruses and bacteria. The activated T helper cell emits chemical signals, influencing the B cell to mature and produce antibodies to a specific antigen. The activated B cell matures into a plasma cell. The plasma cell grows larger and clones itself many times into cells that secrete the same antibody. Each of the cells in the new plasma cell population produces antibodies for one of the 6 antigens in Virus Shield 6. This means uncompromisingly safe and reliable protection for your client's herd and peace of mind for you.
All right, I want to thank again Elanco for sponsoring this talk today, this last webinar of the series. Dr. Perry, if you want to start your video there, I'm going to stop sharing. I want to, if you don't mind, start sharing your screen. Our speaker of today, there's actually 2. Dr. George Perry is being a founding member of the Beef Reproduction Task Force, and started his career in South Dakota and moved to Texas more recently. He's an associate professor in the Texas Agri-Life in Overton, Texas. And he's going to be talking to us today together with one of his grad students, Kaitlin Epperson, who is a PhD student in Dr. Perry's lab. And we're going to be talking about understanding how vaccination can impact herd fertility. So George, the floor is yours. Thank you very much.
Thank you, Vitor. Are you seeing the correct screen?
Yes. Thank you.
Good. Thank you for that introduction, and I appreciate the opportunity to get to be able to share some of the research that we've been doing and how different vaccinations can impact herd fertility. Well, one of the interests of my research program is basically overall fertility of the herd. And I really like to look at it through the equation of reproduction. And so there's 4 big things that can really impact reproductive efficiency. And so we can talk about animals detected in estrus and inseminated as one big area, inseminator efficiency as another area, whether that be the bull with natural service or the technician if you're doing AI, fertility level of the herd, and fertility level of the semen. Well, where a lot of this comes into play is with fertility level of the herd. And if we look across all of these, let's say we do very well, and we do 90 to 95% for every area, we can see that for any single insemination, we would expect about a 73% conception rate. And so that's doing everything very well. But if we have a problem in any one area, and not a huge problem, so see we drop fertility level of the herd from 90 to 70%, you can see you drop any single service conception rates down to your mid 50%. And so when we think about all of the things that can impact herd fertility, it's important that we consider every little aspect. And I tell people all the time, to get the highest level of reproductive efficiency, it's in the details. And so when we think about that, what I want to focus on and what Kaitlin's going to help me focus on tonight is actually reproductive diseases. And so when we think about reproductive diseases, there are several things out there that come into mind. We saw a video that talked about BVD and IBR, but there's also Trich and Lepto, Vibrio, Neospora. We don't have vaccines for all of them, but we do want to make sure we can control things. And the 2 that really stand out from that is definitely BVD and IBR. So they're viruses that we focus on, we vaccinate for, because they can actually impact both fetal infection and hadn't have pregnancy losses. But the other thing is these two viruses can also impact the ovary directly. And so we can actually get dysfunction of the ovary. We can disrupt estrous cycles. And so all of these things come into play, and any one of these factors then impacts the success of our breeding season. And so we want to make sure we're focusing on the details of things. Well, when we started looking at this several years ago, one of the things that stood out is the dogma that was out there is that, in my pointer here, is that when we vaccinate, we knew that viruses could get into the dominant follicle. And if they get into that dominant follicle, they can disrupt luteal function and cause problems. Most of that work was done in the 1970s. And so we've known things like that for quite a few years. But when we think about what we can do today with modern synchronization programs and the impact of them, the question always came up, well, can I save time and labor by vaccinating at the start of a synchronization program? And when we think about what goes on at the beginning of that synchronization program, most of them, we're giving something to induce ovulation of the follicular wave that's there to start a new follicular wave. And so if the virus gets in and impacts this large dominant follicle, but we give GnRH when we put a seeder in, we get rid of this. And we have the seeder in for progesterone, so we don't need to worry about what kind of progesterone the CL that comes from that follicle is producing. And so if that is the true case, then this next ovulation, after we remove the seeder and they show estrus, should be good. And so after getting asked that question many times and stuff, we decided to investigate, okay, what happens when we give vaccination at the start of a synchronization program into naive animals? And we started with this in naive animals because of a lot of heifers and not knowing what their vaccination history was. Well, if we look, when we gave the modified live, even after that follow-up estrus, we still had 40% of the animals that had abnormal estrus cycles. When we gave the inactivated vaccine, either one dose or two dose, we still had about 10 to 15% that had abnormal cycles. The group that just got saline, there was no abnormal cycles. And so as we think about what's going on there, what is an abnormal cycle? An abnormal cycle is anything that will not allow that animal to conceive. And so the days of the study here, this is the timing of ovulation or estrus. And we can see our control animals, as you would expect, a nice increase in progesterone on out through what would be a normal length estrus cycle. These other lines down here are the animals that were abnormal. And we see some of them never had much of a rise in progesterone. Some of them had a nice rise early and then a drop. And that was the majority of these animals. If that corpus luteum regresses prior to the time that maternal recognition of pregnancy occurs, there's no way for that animal to get pregnant. And so when these abnormal cycles occurring, what happened to pregnancy rates? If we see our control group, we actually had very good pregnancy rates. Now we have to realize these were not just synchronized and AI'd one times. These animals were set up with multiple inseminations to get as high a conception rate as possible. When we look, our inactivated vaccines were similar to our control group, and they ran about 70 to 80%. We dropped down to about 30%, so we gave up about 70% of the conception rate in our modified live group. And so when we think about things like that, we can see in these naive animals, we had a big impact, even when we did that at the start of a synchronization protocol that induced ovulation. Because of the way these animals were on the study, we were actually taking blood samples to get all of those lines to know normal length estrus cycle. We were able to look at and determine the second service. So when a cleanup bull was out with them. And what we can see is in the modified live group, again, we were only between 30 and 40%. And so it's not just that first ovulation, but it continued on. So this really changed the way we started thinking about what impact we could have. It's not just this dominant follicle that is present when we vaccinate that can be impacted, but we know we impacted this follicular wave also because we disrupted the CL that formed after these animals exhibited estrus. And then what really stood out was this return estrus. We impacted it also. And so we gave up conception rates to all of those different inseminations with that modified live vaccine. Now, if we go back and look what can be going on, we know that specific viruses, and this slide talks mainly about IBR, when it was given 7 to 28 days post-breeding, it actually resulted in damage to the corpus luteum. And you can see from the pictures what a normal CL would look like and what some of the necrotic lesions and the mononuclear cell invasion occurring to disrupt that luteal function can look like. And so by looking at that, we've known for a long time in naive animals that we can disrupt this luteal function. But it's not just luteal function. We can see here ovarian damage that can also occur. And we can see the invasive cells, the lymphocytes invading into the ovarian stroma. We can see necrotic tissue. This is next to a corpus luteum. That can also occur when animals are vaccinated at different times. In this study, the ovaries were collected 9 days after vaccination. And you could see all of this disruption to the ovary. Those studies all looked at IBR. There's other studies that have also looked at BVD. And so when we look at that, the study that got up here now actually collected the ovaries 10 days after vaccination. And they were looking to see what damage could be occurring and the different cells that would be moving in. And if we look, you can actually see the brown dots here are positive for BVD. And so within the ovary, they were able to pick up the BVD antigen 20 days after vaccination. More specifically, by immunohistochemistry, from 10 to 30 days, they had cells come up positive. And so we know that in naive animals, that virus can get into the ovary and impact it for extended periods of time. While we're thinking about those details, and we think about the pregnancy rates, the timing of ovulation, and all of the things that need to occur for a successful insemination, if we have naive animals, we really want to avoid using a modified live near the start of the breeding season. Now, what is the definition of a naive animal? A true naive animal is one that has never been exposed to that antigen. Now, in reality, how do we know? Unless we gave the vaccine and know it was given, it's hard for us to know. And I can tell you many examples of producers where I've been called in to help troubleshoot problems that, oh, we bought this group of heifers, they were vaccinated, and we gave them the same vaccine, so it shouldn't be a problem, and we're having problems. We'll come to find out something wasn't actually given, or a different vaccine was given instead of what they were told. So what I like to tell people is, unless you gave it, unless you know it was administered, consider those animals naive to try to avoid these problems. Because with my training as a reproductive physiologist, my goal is always the best conception rates possible. And so I want to avoid anything that can hurt those conception rates. Now, after that study in naive animals and the data we've known, the question really started coming up, what about well-vaccinated animals? What about animals that have been vaccinated prior sometime in their life? And there's two studies that a lot of us have always referenced because they sort of looked at it. And this is one of the studies. Dr. Stormshak did this study. It was published in 1997, where they vaccinated with a modified live vaccine either 30 or 9 days prior to the start of the breeding season. If you look, estrus expression, mid 70%, which is actually very good. No difference between the two. AI pregnancy rates, no statistical difference. And there's about 300 animals in this study, but no difference between those. Breeding season pregnancy rate, again, no difference. So from that, we would think there's no difference between them. Here's a second study. It was published in 2007. These animals all had 3 doses of a modified live prior to the start of the breeding season. The second dose occurred 90 days prior to peak breeding. The third dose, either 40 or 3 days. And if we look, the graph on the left, conception rates, through day 45 of the breeding season, no difference between the treatments. First service conception rates, no difference. Second service conception rates, no difference. Days to conception were not statistically different. Days to conception for first and second service, not statistically different. So from both of these studies, most of us always assumed there was no effect. But in reality, when we think about these two studies, what's missing? There's not a negative control in those studies. They were looking at the timing of interval between the vaccination and the start of the breeding season. And I'll come back to that later. So in getting asked the question, and we start looking through the literature, there's not many papers that had looked at a modified live versus a inactivated control prior to the start of the breeding season. There were a couple of small studies, and this was one that was published in 1995. There's a group of modified live and a group of inactivated vaccine. They were given 40 and 10 days prior to breeding. That's these two bars, or 61 and 31 days prior to breeding on the right. And what we can see is there was a 20% difference and a 15% difference between the modified live and the inactivated vaccine in both of these groups. Statistically, there was no difference between them, but when we look, there was 10 to 20 animals per group. So we're really only talking about 2 animals difference in this study in both of those groups. More recently, there was a paper that came out, had a few more animals in the modified live. There were 60 animals in that group. And when you compare it to the saline group, there was a 20% difference in pregnancy rates. And so we really were getting asked the question a lot, and Russ Daly and myself worked on developing a study, and we decided when we went into it, it needed to be designed to pick up a difference if one existed. And so in doing that, this study was designed that anything less than a 10% difference could be picked up. So if there was a 10%, it definitely would be picked up. Actually, the power of the test is down to about an 8% difference. There were 1,436 cows and heifers across 9 herds over 2 different years. Within herd, animals were blocked by age and previous calving date. All animals had been previously vaccinated with a modified live prior to the breeding season for their known life on the operations. And so we considered them to have been previously vaccinated. And the calving data, there were some sold for non-reproductive reasons, but we actually tracked these animals all the way through. We set up 3 treatments. There was a modified live group, a killed vaccine group, and a saline group. And everything was done strictly by the label, where they were vaccinated 30 days pre-breeding for the modified live, 30 and 60 days pre-breeding for the inactivated vaccine, because they had never received that vaccine before and the labels all read you need to give a booster, or they got saline 60 and 30 days before breeding. And so when we look at how this lays out, all the animals were synchronized using the same protocol. They all received the 7-day co-sync plus CEDAR protocol. They were all fixed time AI'd. If they were cows, 60 to 66 hours after CEDAR removal. If they were heifers, 52 to 56 hours after CEDAR removal. The difference was the modified lives received their vaccination 30 days prior to the CEDAR going in. The inactivated vaccine received theirs at 30 and 60 days, or the saline group received saline. And yes, even the modified live was given an injection of saline at day minus 60. So everything got the same number of sticks with a needle. We then came in, an ultrasound determined pregnancy after the AI period, and then also during the breeding season. And so how did those pregnancy rates turn out? Well, if we look for just AI pregnancy rates, we can see the inactivated vaccine was just below 50%. The saline group was intermediate, and the modified live group was about 40%. There's about an 8% difference between the modified live and the inactivated, and the p-value for that was 0.055. So there was a 5% chance, or a 5.5% chance, that this difference occurs just due to randomness. We did a preg check at day 56 of the breeding season. Why is this important? Well, at day 56, by ultrasound, we can pick up not only the AI pregnancies, but we can pick up that first return to estrus of the bull too. And so we wanted to see on that first return estrus, because if somebody had an abnormal cycle, granted bulls were kept separated for 10 days, but if they had a short cycle, we would actually see what was occurring. And what we actually see is both the inactivated vaccine and the saline group were statistically better than the modified live at day 56. At the end of the breeding season, we returned to a pattern just like we had at AI, where there's a difference between the inactivated and the modified live, and the saline is intermediate. And so in looking at that, there was something going on. Now, we often get asked the question, what vaccine has the best protection? Because in reality, why do we vaccinate animals? We really vaccinate them to protect them, and in some cases, especially like with BVD, to keep them from having calves that are PIs, or for IBR or BVD, either one, from that fetus getting aborted. And so which one has better protection? And so the group at Auburn actually did this study where they had a group of animals that at weaning received saline or a modified live vaccine. They were then vaccinated again. They were bred, preg checked. Out here, the next year, they split the group that had been vaccinated with a modified live at weaning into, they either got a modified live or an inactivated vaccine or saline. They went through calving. They were bred again after pregnancy diagnosis. So they knew these animals were pregnant. They exposed them to a BVD PI animal. They Vaccinated them again. So if you look at this, they're on a yearly vaccination schedule. And then they inoculated them with IBR, with bovine herpes virus 1. And they looked at abortions. And so these had been well-vaccinated animals in the one group. One group, Group C, had received saline their entire life. How many animals actually aborted? Well, if we look in Group A, there were actually 3 animals that aborted, 3 out of the 23, so a 13% abortion rate. 2 of the animals came up positive for BVD. So this was in the modified live group. In the inactivated group, there was 1 animal that aborted. It was not positive for BVD. In the saline group, this group had only had saline its entire life. 11 of the 15 animals aborted. 14 of the fetuses and calves, so there were calves born, 14 of them, so 93% tested positive for BVD. And so these calves that were born were actually then PIs and would continue the process in that herd. If we look at bovine herpes virus 1, 2 of the aborted fetuses were positive for bovine herpes virus 1. And if you look, it was actually a different 2 than what were positive for BVD. None of them in the inactivated group, and 8 out of the 15, and they were all the fetuses, were positive in the control group. So when we look across all of them, for BVD and bovine herpes virus, 4 animals tested positive in the modified live group, 3 abortions occurred. In the inactivated group, 1 abortion occurred. None of them tested positive for either one. In the saline group, all 15 tested positive, whether it was an abortion or a calf, for one of the 2 viruses. And so if we look at that graphically, we can see high levels of abortion, and those that didn't abort were still infected, versus low levels of abortion in both of the other vaccine groups. So what does this really tell us? In a good vaccine program, when animals are vaccinated correctly and set up correctly, we can come in and use either a modified live or an inactivated vaccine and actually have very good success. We can still protect that animal. So we wanted to come back because there was questions on that first study. We were right at a significant p-value. We came back with a different inactivated vaccine and compared it to a modified live again. And this time we worked with more producers. And so there was a little bit more of a range that occurred. There were 10 herds, 1,565 animals. Just like before, they were blocked by age, calving date within each herd. They were all synchronized and AI'd the same way. We just did 2 treatments. We did the modified live or the inactivated vaccine. We ultrasounded for fetal age to determine pregnancy success at day 34 and 86 after AI. So we knew when they got pregnant. And so graphically, if we look at it again, same synchronization protocol, the 7-day cosync plus CEDAR, same timing for fixed time AI. What varied was, since we were working with cooperator herds, is they ended up getting vaccinated somewhere between day 27 and day 89 prior to the start of the breeding season. In heifers, this would have all been their second injection. In cows, they only got 1 injection. And so we wanted to see what impact this happens when we take it to the real world and what producers would actually do. If we look, this modified live, again, was about 8% lower. This time it was at the 0.05, so it's significantly different between the modified live and the inactivated vaccine for AI conception rates. Breeding season, there was no difference. And so when we look at that, we've got over 3,000 animals, 19 herds that we've seen about an 8% difference in AI conception rates. And so then the question really comes into what is going on that can be impacting it? Because these animals have been vaccinated before, we wouldn't expect the same as what we were seeing in the naive animals. And so this is where I want to turn it over to Kaitlin, who's a PhD student working with me. She's actually been involved with the vaccine stuff for 4 or 5 years now, and let her talk some about what her project has been doing and the mechanism that may be impacting it. So Kaitlin, I will let you present.
Good evening. Thank you, Dr. Perry, for that introduction, and I'm glad to be able to continue these topics with you this evening. And Dr. Perry mentioned there's quite a bit of differences occurring right now in terms of pregnancy rates when we administer a modified live vaccine or a killed vaccine too close to the breeding season. And so what we're interested in trying to answer is what exactly is occurring at the level of the ovary and what is causing some of these differences in pregnancy rates. And so he mentioned before that there's several different things occurring, not only for the dominant follicle, but also for the corpus luteum, which is the structure that's formed after ovulation and is responsible for producing the hormone of pregnancy, progesterone. And we're realizing that after viral infection, either from the natural virus itself or from the virus contained within a vaccine, there's several things that can happen in terms of the functional and cellular changes on the ovary, including inflammation or cellular degeneration, invasion of plasma cells, which secrete antibody, or even infection of the oocyte or the egg. But he also mentioned that there's a specific affinity of these viruses for the corpus luteum or the CL. But we're unsure so far of what those specific mechanisms that are causing the damage that is specifically occurring. And so one of the things that we wanted to try and answer is what exactly is occurring to this corpus luteum after vaccination. And to answer that question, we designed a project and executed in 2020, the awesome year of COVID. And we had about 79 Angus cross beef cows that we subjected to ester synchronization with the 7-day co-sync protocol. And for that, we started with an injection of GnRH and put in CEDARs on day -10. We removed the CEDAR 7 days later and then gave prostaglandin. And on day 0, when AI would normally have occurred, instead we vaccinated with either a modified live vaccine or with a killed inactivated vaccine. We also ultrasounded for ovaries to check for dominant follicles. That later on, day 3, we returned again to ultrasound to make sure that those dominant follicles had ovulated so that we could have the presence of corpora lutea after that. And so by days 10 to 13, we selected 13 treatment animals that had received vaccine, and then an additional 10 that had not received vaccine at all. These served as controls. And we subjected them to ovarectomy surgeries so that we could collect the ovaries and specifically dissect out the corpora lutea, which is pictured here. And we were seeking those so that we could section them and prep them so that we could look at a cellular or histological level, which I'll describe later. And then also it's important to notice too that we took blood samples every other day during this time period so that we could look at progesterone and also different secretions from immune cells, which I'll also mention shortly. But looking first at our progesterone data, I'll remind you that progesterone is the hormone that we're really interested in coming from the corpus luteum. And without progesterone, there's no maintenance of pregnancy. And we can also look at progesterone to determine how regular their estrous cycles are, as Dr. Perry mentioned previously. And what we realized from looking at this data is that there were 24% of animals in the modified live treatment group that had an abnormal estrous cycle, whereas there was 0% in the killed treatment group. And I'll talk about this a little bit more on the next slide. But I'll also point out that when we looked at the mean values of progesterone between treatments, It didn't matter if we only analyzed the data with animals that normally cycled or between animals normal and abnormal. In both cases, you can see in the gray bar that the modified live treated animals had lower concentrations of progesterone compared to the killed. And so I mentioned that we would return briefly to talk about those animals that had abnormal ester cycles. And Dr. Perry had mentioned that these would be animals that would not be capable at that time point of maintaining a pregnancy. And so it's definitely interesting that we're noticing a 24% difference here. But if we look at that 24% and try and figure out what was happening with those animals, we found that 3% of those had a delayed increase in progesterone after they had ovulated. And that's shown by these two animals in the bottom left here. But majority of that 24% were animals that had a corpus luteum that regressed before the time period that it should have. And typically we would expect a corpus luteum to live to day 16 of the ester cycle, but you'll notice in this graph that most of this 21% lost their corpus luteum between days 8 and 14. And so this is suggesting to us that there's likely some other type of factor playing a role in causing early regression of that corpus luteum, which is concerning considering that it's required for maintaining pregnancy. And so again, to kind of hit home this idea of reduced progesterone, we saw it across all time points throughout the study that you can see this gray dashed line as the modified live treatment group compared to those that received the killed and activated vaccine. But in moving forward and looking at some of the cellular level results that we found in doing the histology, I'll draw your attention first to panel A and looking at one of our control animals. And these are images that are sections of the corpus luteum or the CLs. And you'll notice that this is very typical of what we would expect to see. The large luteal cells have larger areas of pink or cytoplasm stained here with acentrically noted nuclei. The small luteal cells are kind of squished in between these other large luteal cells. So this is what we would typically expect to see. And if we compare that to an animal that received the inactivated or the killed vaccine, you'll notice immediately that there's increased numbers of cells present here. And these are not luteal cells. They're very darkly stained and much smaller. We suspect, based off of what we've seen so far, that they're probably immune cells or fibroblasts. But this is even more so different from an animal that received the modified live vaccine. And so you can see clearly here that there's an abnormally few numbers of cells present, and the cells that are present are misshapen and do not have a healthy appearance. And then here's another example of an animal that received the modified live. And so clearly these large luteal cells that are pictured here are likely undergoing cell death, also called apoptosis. And so this would not be beneficial for being able to produce progesterone. And this is just a visual representation. If we put that in terms of numbers, you can also notice that there are two different bars noted for the modified live group. And this is to account for animals that had 2 corpora present at the time of ovary collection. The new CL would be one that had formed after an abnormal estrous cycle, whereas the old CL would have been present after the initiation of the synchronization protocol. And so in terms of the total cell counts, this graph kind of reiterates what we're seeing from this inactivated image in panel B. You can notice that the total cell numbers were greatest for the killed treatment and least for the control. And then likewise, when looking at percentage of large luteal cells, which would be those cells that produce the progesterone, the lowest percent was observed in the modified live treatment group, both the old and new CLs. Killed was intermediate, and then the greatest percent, as we would have expected, was seen in the controls. And so to follow up some of this histology, we also wanted to confirm the presence of those cells that might have been undergoing cell death or apoptosis. And so first you'll notice any cell that was stained blue would be a cell that was not undergoing cell death. However, if you notice cells that are stained pink or red, these would be those that are undergoing apoptosis. And so you'll see that there's not very many of those pictured here in this panel for the modified live old CL, which I'll remind you, the old CL would be one that was present after the initiation of the synchronization protocol. But if you compare that to the modified live newer CL, so this would be one that had showed up after an abnormal cycle, you'll notice quite a few cells that are undergoing cell death here. Same with, here's another example depicting the same thing. But lastly, if we compare these to the killed or inactivated, you see hardly any. And this was confirmed when we put it in terms of cell counts. You'll notice that about 35% of cells were apoptotic for the new CL and the modified live treatment group, whereas less than 5% was observed in the killed treatment group. And so this is confirming that there's something else occurring in the corpus luteum that's causing these luteal cells to die and not produce enough progesterone. And so we wanted to follow that up by trying to figure out what specifically could be occurring to cause this type of reaction. And we were curious whether or not immune cell secretions, also called cytokines, the video that you saw in the beginning of the webinar briefly touched on some of these. It's how immune cells can communicate. We wanted to know if some of these cytokines could have been inducing cell death for these luteal cells. And so we took a subset of animals on a handful of collection days and looked at 15 different cytokines. And those are depicted in this table. Many of these are pro-inflammatory cytokines. So that means that they propagate the immune response. And you'll notice that we had an effect of interferon gamma concentrations being different between treatments. But what I'd really like to share with you this evening is some of the differences in treatment over time for some of these cytokines. And in particular, the first of these also being interferon gamma, which is pro-inflammatory. And you'll notice that on day 2, the concentrations were increased for animals that received the modified live. And this was 2 days post-vaccination, both for modified live normally cycling and abnormally cycling. And then next, similarly, when we look at interferon gamma induced protein 10, there was also an increase for these treatments on day 2. But what's more interesting for this particular cytokine is there was an increase between days 2 to 6 for the killed treatment group. And so this is illustrating that the killed inactivated vaccine group is not totally immune, if you will, from some of these effects of the cytokine concentrations. And also monocyte chemoattractant protein, which is a cytokine that's responsible for causing an influx of other immune cells into the area that it's being secreted. We also saw this increase from day 2 to 6 for the killed treatment group. And so this makes me wonder if this has anything to do with the increased numbers of cell counts that we found from the killed and activated treatment group that I showed you earlier. And then lastly, macrophage inflammatory protein, which is also a pro-inflammatory cytokine, was significantly increased for those that abnormally cycled and that received the modified live vaccine for all time points for the days that we had measured post-vaccination. And so really what these things are illustrating, I realize there's a lot of complicated physiology and words that I've just thrown at you, but truly what this is telling us right now is that modified live vaccination does negatively influence the development of the corpus luteum and also its function and its ability to produce progesterone. And this can in turn have implications for your breeding season in terms of pregnancy rates, dependent upon when some of these vaccines are administered. And we're realizing that there's different cytokine profiles that are indicating that the immune response is playing a role in terms of how the ovary is responding to vaccination. And we saw this from the increased pro-inflammatory cytokines that were increased following vaccination.
Thank you, Kaitlin. So one of the questions that really comes from this, and when you see what Kaitlin shared, is there's impacts both in the modified live and the killed, is when should we really be doing things pre-breeding? And we need to break things apart. In replacement heifers, we need to be vaccinating before or at weaning, and getting them set up correctly in life. Both heifers and cows, we're going to say, should be vaccinated at least 45 days before the start of the breeding season. And I'll explain why in just a second. And if they've never been vaccinated before, as I showed in the very first study, we want to avoid a modified live near the time of breeding. So why do I say 45 days? In the one field study that we were looking at, and producers vaccinated anywhere from 27 to 89 days pre-breeding, what was interesting is we went back because, as Kaitlin pointed out, we're seeing effects both in the modified live and in the inactivated. We can see that the inactivated, as we showed earlier, was higher than the modified live at all of the time points. But in both of them, look at the jump increase from day 37 to day 46. So these were all vaccinated between 46 and 89 days pre-breeding. And so in both groups, we see when we give the ovary time to get over this negative effect, we see an increase in fertility. This makes sense to me as a reproductive physiologist, because if we look at the follicular-genic cycle in a cow, it's 42 days from pre-antral period. So this stage here to the time of ovulation, or if we go all the way back to when they first start activating, when they first start growing, we have a 90-day period. And so we can impact this follicular growth any way through. And so if we're having negative effects on the ovary, we need to give it time to get out of the system. And so that's the reason we're really recommending we need to get vaccines in as early as possible and get them in early so we can get over any of these negative effects on the ovary. And so with that, there's all kinds of people who've helped with these studies, especially Kaitlin and grad students who have done most of the work with this. And at this point, I will be happy, and Kaitlin too, to answer any questions. I see some questions already popping in. So let me get where I can get to the
Thank you, George.
question box here.
Yeah, I want to remind everybody to please type the questions on the Q&A. Don't do it on the chat because it's a little bit hard to keep track of them. Please do in the Q&A here. So I think, George, you can see that first one there.
Yeah, so the first question that has popped in is, would it be possible to know which vaccines were used on those experiments? Yes, all of the published papers have which vaccines they were used. We have to put that into all of them. We've used Virus Shield, we've used Cattle Masters, we've used Bova Shield, we've used several different vaccines. And so it hasn't, especially the two large field trials, the inactivated vaccines were different each time. And that was one of the other things that we wanted to change, was make sure it's not just the comparison of these two vaccines. We have not compared all the vaccines. As you would guess, we would have to run around and be vaccinating and breeding cows constantly for every possible comparison. So they haven't all been, but when we've gotten into some of the smaller studies, we have used multiple other vaccines and we see very similar results. And so I can't tell you every comparison, but the references were on all of them, or if you want to email me, I'll be happy to share which vaccines were used in each study.
George, I have a question. Would you recommend vaccinating heifers at the beginning of the 14-day CDER protocol?
That comes up quite a bit, and it came up a lot even when I was in grad school on the old, longer MGA protocols. It is a time, we are at a 33-day window, and if you go back to even the papers that were published by Stormshack and Bolton, when you're at that 30-day window, that timing is in there. You're better off than if you're closer, but I still think there's room for improvement if we can get further out. And so that does give another cycle in there. but you're not 2 full cycles through where we've seen that big change. But yes, I mean, if that's your only chance to get them in them, it's better than at the end of the 14 days. But like I said, as early as possible is what we've been trying to do.
Okay.
Let's see. Next question. This rule are applying also for dairies. There are several studies that have looked at it in dairy heifers, and you see very similar effects. And so, especially on the heifer side, some of those have hold true. When you look at the modified live versus a killed, there is actually a large dairy study. They were out at 45 days. There was no difference between the two. So yes, even in the dairies, when you get out for far enough pre-breeding, that has held true. So there are studies on both. All of our work has been on the beef side.
George, there's a question, they missed the 45-day prior to breeding with a killed virus vaccine. When would be the next best option to vaccinate?
So if you come in, you have to look at what has been done to that animal before. And so we do have killed vaccines that are safe in pregnant animals. And so if you're worried about getting it in pre-breeding, you can come in at preg check after that animal has well established a pregnancy. And we do have inactivated vaccines that are labeled, we know are safe to use in pregnant animals, and you can get it into them at that time. And so there are several herds that we work with that do their annual vaccinations prior to calving to help booster immunoglobulins in the colostrum. And so, but you're using a vaccine that is safe to use at that time point.
There's a question. So if you have a group of naive heifers, there are 60 days pre-breeding. Would a single shot of killed vaccine prior to 45 days, followed by a second and third vaccination of killed post-breeding? It's a little hard to understand. It's Stephen Rice that wrote it down, and if we can read it there.
Yeah, so the way I take that is if you only get one shot into them in a group of naive pre-breeding, what is it safe to do later?
Yeah.
As long as you can get something into them pre-breeding, you're getting them set up to help avoid things. Really, the goal and the overall thing of all of this, it really depends on what your risk exposures are. And so anytime with a vaccination, we think of it as an insurance policy. If you are vaccinating to keep from having PI calves, to keep from having abortions, you have to also control that by the risk exposure. And Kaitlin, during her master's, ended up with a study that wasn't really planned, where she was working with a group of heifers on resynchronization. And one of the heifer development facilities ended up with some BVD exposure. Every one of the heifers in that facility had been vaccinated, was well vaccinated, and we still ended up with lower conception rates because there was a PI that got brought in among them somehow. And so with that, we can overwhelm any vaccine. And so we need to pair a good vaccination program with also biosecurity and knowing our risk factors. And so that really also comes into play in working with your local vet to know what your risk factors are. But yes, we try to get stuff in to prepare them for the breeding season to reduce any risk from that. One of the benefits, we weren't able to test all the calves. We did test some of them. All those animals were vaccinated. Even though the AI conception rates were lower, of the calves that we were able to test, none of them were PIs the next year. So the vaccines did work very well that way. There were killed, there were modified live, both in that study.
There's a question about effects of vaccination on oocytes through IVF, like OPU and that.
Yes. So if you wash the oocyte, the virus itself does not get through the zona. And so if the virus, it will attach to the zona, but if they are washed correctly, you can actually wash it off. That's the reason we can import or transport embryos across countries or between countries without the risk of transmitting the viral diseases. It's because you can, when they're handled correctly, avoid that and not be contaminating them.
So similar question there, but on the donor cows, studies showing effects of vaccination on donor cows prior to flushing or IVF, any effects on embryo production rates?
So we haven't looked at it with donors or recipients. I do know some of the embryo transfer companies have started to look at it. They've done it more of a switch and then retrospectively comparing things. And so when you look at that, there haven't been any design studies side by side comparing a modified live or a killed vaccine in the recipient. In the donor animal, it's not as big of an effect because we flush those animals out before the time of maternal recognition of pregnancy. And so if we disrupt the ovary, yes, we can impact things that way and decrease progesterone production, but it really depends the environment. We're more worried about the recipient because that's where the CL has to then maintain that pregnancy. But there haven't been good studies looking at it that way.
There's a question like, so would pre-service vaccination avoid the need for post-service vaccination? I'm assuming pre-AI versus
yes.
That.
So I've got friends that work at all of the pharmaceutical companies. When we've looked at it, almost all of the vaccines that are on the market in the US actually have a 12-month, I'm losing my words, duration of immunity. And so they've been tested out to 12 months. So if you vaccinate pre-breeding, do you have to do it? Pre-calving? No, you will maintain that immunity. The reason, and there's another question as I was glancing down, would you ever do a pregnant animal? There are herds that actually prefer to vaccinate with inactivated vaccines while their animals are pregnant because they will actually see a boost in the IgGs and the immunoglobulins in the colostrum. And so, yes, sometimes there are benefits to vaccinating a pregnant animal pre-calving to build up the immune system, because you got to realize all the antibodies that are being put out by that cow pre-calving will end up in the colostrum. And that gives a bigger boost of immunity to that calf when it's born. And so you weigh your options in the timing, your management. We've got a study right now that is carried out. We're not just looking at, because the previous study, we could look at that 45 days, but we're trying to carry that out on further and build our numbers up in another study that we've started this year with both the modified live and the kills of, okay, if we go further out, do we see differences? How close, and things like that to build those numbers up.
So if 45 days is the magic number, does that mean 45 days before AI or the CEDAR goes in?
So in our studies, we were doing that before the start of the breeding season. And most of the time that was 45 days before the CEDAR, the start of it, because that was always our day zero. I don't know, 45 days gives you 2 cycles, 2 estrus cycles, a full turnover of preantral to ovulatory follicles. Unfortunately, with numbers, can I say that's the magic number? No. The further out you get, the better off we can be. And so getting them in that range is what really gives us that benefit.
There's a question about effects on testicular tissue and perhaps testicular function with vaccination. Are you aware of any effects?
So on the male side, no. Actually, we've been asked that a lot. I'd really love to look into it. I don't know of anybody who's looked at either one of them really on spermatogenesis. We've thought about it a few times. How would you design that? How frequently to collect it? We now, in my current position, we've got the equipment that we can do those and actually look at more than just motility, because what you're looking at are some of those changes. You want to be able to look at, does that sperm impact fertilization, capacitation, membrane integrity, all of these different measurements. But as of yet, there's not any studies really looking at the effects of modified live or killed on the male side. To address one other one, there's one up there on the Bactrians on fertility. We have looked at that. So actually one of the studies we did, one of the field studies, we actually gave the viruses as one injections and the Bactrians as a different. We used the exact same Bactrian for all the animals, and we saw no effect. And so most of it really seems to be the virus and its ability to get in, upregulate the immune system, or replicate in the body to really have that effect. We haven't seen the negative effects with the Bactrian side of the vaccines.
Okay, there's 3 more questions there, I guess. Would you ever recommend vaccination during pregnancy? I think you touched on that a little bit, but perhaps.
Yes. So during pregnancy, the time, if you're really wanting to do it during pregnancy, is either because you can't get it in pre-breeding, or because you really want to build the immunity, increase the colostrum. And so that allows you to vaccinate to a pregnant animal to build the colostrum, that side of things. Let's see, the next one is, from what we saw, there's no advantages of the modified live in either reproductive or immune protection. You really have to look at the situation you're in. And unfortunately, there's not a one size fits all. And so there's some situations that a modified live, you've got to realize in some of the tests that I showed, yes, the inactivated gives very good protection. Those animals were set up at weaning with a modified live. And so all of those combinations have not been compared. And so if you're in a high risk situation, you may benefit from the modified live. There might be a risk factor that's going to impact your reproduction more than vaccination. And so you really need to work with your local vet, because unfortunately, IBR, BVD, these diseases are not reportable diseases. And so the only people who are going to know what you're needing to protect against in your area is either going to be your local vet or your extension people in the area that have helped other producers get through situations. And so they'll be able to recommend, okay, they can't tell you what other people are doing, but they can recommend, especially your local vet, we may want to increase your protection. So we may want to up things. And so it's really important you're working with them on what is the best in your situation. The last one, BVD can penetrate the zona. Export requires PI testing prior to export for most countries. Like I said, I haven't looked at it on the oocyte side. The one study I thought I'd read is you could wash it off the oocyte when you freeze it, if it's in, because a lot of times freezing will crack the zona. And so it might be penetrating that away. But yes, we always do want to make sure that we are PI testing. From Kaitlin's study, if we are dealing with a PI or BVD during reproduction, our conception rates are going to be dramatically impacted anyway. So we want to make sure they're as controlled as possible. So.
Very good. We cleaned up all the questions, George. One more time.
Very good.
I want to thank you again for presenting, you and Kaitlin. Great presentation. Again, thank everybody for tuning in. This is our last webinar of the spring. And we, again, we have plans to keep this going over next year. And I'll be very glad to see most of you, if not everybody, and San Antonio on August 30 and 31st for the in-person ARSBC this year. So we're very excited. And again, stay tuned on our website and Facebook page so we can share more information about the meeting over the coming weeks. This presentation is recorded. We're going to be posting on our YouTube channel all the previous webinars this year, the past year, as well as ARSBC for the past 2 years. All those videos are there on our YouTube channel. So make sure to follow us and subscribe to our channel so you can keep up with the presentations that we have there. And again, thank you very much, everybody, and have a good night.
Thank y'all. See you in San Antonio.